Next on Link TV. Latin Pulse, news and analysis from Latin America as seen by Latin American media, followed by a panel discussion on the issues. Next on Latin Pulse, only on Link TV.
The following program is an original production of Link TV.
The increasing cost of healthcare, an ongoing debate in the U.S., and a critical issue in Latin America. With so many different medical systems in the region, who does a better job, the government or private industry? This and more coming up next on Latin Pulse. Hello and welcome to Pulso Latino. I'm your host, Ana Cuevas.
Aumenta la cantidad de gente que necesita atención, debiera aumentar también la cantidad de gente que entrega la atención, y sin embargo no se hace.
Healthcare, an ongoing issue here in the U.S., but by no means an exclusive problem. Less fortunate countries have even more severe healthcare issues and fewer resources to deal with them. This becomes an even bigger problem when corruption is added to the mix. As we see in this report from Colombia's RCN, the burden often falls on those who can't afford the care to begin with.
La Contraloría General de la República asumió la investigación de Salud, entidad que vendía medicamentos a sus afiliados en Chocó hasta un 400% más del valor. Sin embargo, para el gobernador de este departamento, primero se tienen que presentar las pruebas que den fe de este hecho.
Y no creo que ellos se vayan a prestar para ponerle un precio a unos y otros a otros. Pero si ellos tienen evidencia de que hay sobrecosto, que lo denuncien.
Los sobrecostos se presentaban en cerca de 20 medicamentos incluidos en el plan obligatorio de salud. Por ejemplo, un jarabe para la gripa que cuesta 750 pesos era vendido en 2.450 pesos.
Other countries like Guatemala are trying to fight the high cost of medical care by manufacturing their own medicines. But as we see in this report from Guatevisión, a Guatemalan lab is now being challenged in court by the pharmaceutical company that claims to hold the patents.
El jefe de bancada del Partido Unionista pidió al ministro de Economía la destitución de Rodolfo Godoy del registro de la propiedad intelectual por considerar que el funcionario en mención está al servicio de empresas transnacionales de medicamentos en detrimento de la industria nacional.
Una compañía transnacional, Pfizer, interpuso una demanda en contra de un laboratorio acusándolo de que transgrede una patente que les pertenece. Este laboratorio logró demostrar con informes del registro de patentes del Ministerio de Economía que no violaba ninguna patente.
Los unionistas denunciaron que el registrador de la propiedad intelectual intentó perjudicar al Laboratorio Nacional Biocross. El registrador se negó a dar declaraciones, mientras que el ministro de Economía aseguró que Biocross no violó ninguna patente.
Venezuela is also trying to control the increasing cost of healthcare. The government is threatening to limit what private clinics can charge for services and medicines. They say the clinics are making huge profits at the expense of the Venezuelan people, as we see in this report from Globovisión.
Nosotros no podemos compartir criterios de ganancias groseras en el ejercicio privado. Tenemos que buscar un punto de equilibrio.
Recomiendan que el Ministerio de Industrias Ligeras y Comercio dicte una resolución interministerial para regular los medicamentos y que el Ministerio de la Salud establezca costos unitarios para los procedimientos médicos más recurrentes y clasifique además las clínicas dependiendo de los servicios que presten y del desarrollo tecnológico de las mismas. Establecerán una factura única, la cual estará a cargo del CENIAC.
En ella debe reflejarse inclusive el consumo real de los medicamentos.
Proponen además activar la Contraloría Social a través de los consejos comunales por intermedio de los comités de usuarios y de salud.
In Chile, the government provides free medical care to those that can't afford it. The system is now going through rough times. Public hospitals are struggling to provide care to those who need their services the most. Chile's Canal 13 reports this becomes even more critical during the Southern Hemisphere's winter season.
Esperas de hasta 6 horas. Los boxes de urgencia atochados. La posta central vivió una noche crítica cuando los funcionarios se vieron sobrepasados por la alta demanda de atención. Muchos han tenido que hacer doble turno para cubrir a los que faltan por enfermedad.
Aumenta la cantidad de gente que necesita atención, debiera aumentar también la cantidad de gente que entrega la atención. Y sin embargo no se hace.
No tenemos las personas, efectivamente, eso sí, para reemplazarlos a todos. Estamos buscando, digamos, al personal con el objeto que efectivamente poder disminuir en parte lo que es la carga, la sobrecarga asistencial del servicio de urgencia.
La posta central debió trasladar anoche a 5 personas a clínicas privadas, una realidad que se repite en otros servicios. La situación más crítica se está viviendo en el sector sur, especialmente en el Hospital Padre Hurtado, en donde las esperas para ser hospitalizado pueden superar las 24 horas.
To help fight the shortage of doctors in the region, Venezuela is offering scholarships to hundreds of students from Bolivia. This would allow them to study medicine in Venezuela. Venezuela's Telesur reports this regional effort is part of President Hugo Chávez's Plan ALBA to unify Latin America.
Wilmer es uno de los 6.000 estudiantes bolivianos que prácticamente sin posibilidad de continuar estudios superiores aquí, optaron a una beca en Venezuela. De los casi 6.000 postulantes, fueron seleccionados por profesores venezolanos 734. El programa está a cargo de la Fundación Gran Mariscal de Ayacucho.
La mayoría de ellos van para medicina integral comunitaria, y el compromiso con ellos es que ellos regresarán no solo a Bolivia, sino a sus comunidades de origen para sanar, para facilitar el acceso a la salud, para democratizar la salud, y ese es el gran compromiso.
Este programa de la Alternativa Bolivariana para la América, ALBA, también incluye a Cuba, donde estudian 5.600 jóvenes bolivianos.
Me gustaría salir al exterior a poder estudiar ahí. Así poder superarme, no sé.
Joining us to discuss the issues surrounding medical care in Latin America, we have in our studio today Marianne Tenuto Sanchez, who has done extensive work in southern Mexico with the Chiapas Support Committee, and Nick Benko, Program Manager at the Child Family Health International. And from Washington, D.C., we're joined by Dr. Benjamin Caballero, Board Member of the Pan American Health and Education Foundation. Thank you very much for joining us. Mr. Benko, there seems to be a lot of inequalities throughout Latin America when it comes to health care. Most of the countries have state-run medical systems. Is this the answer, or why are there these inequalities?
I believe that it is the answer. The problem in Latin America, we have programs, for example, in Bolivia, Ecuador, and Mexico, is the lack of resources that the healthcare systems have and the lack of medical supplies. Is not the fact that the idea of a healthcare system that is free for all is there, but the main problem is the lack of resources because of lack of funds from the government.
Is it a part of it mismanagement?
A large part of it in some countries, such as Mexico, it is mismanagement, I believe, but in Bolivia, for example, it's not. It's just the fact that the country does not have the resources.
Mr. Caballero, are these, since the programs aren't working in Latin America, there seems to be a lot of problems and issues that are coming up with mismanagement, as Mr. Benko mentioned. Are there things that the United States can do to help these countries?
Well, before answering the question, let me follow up on Mr. Benko's comments. It is certainly true that lack of resources is a critical factor, but a lot of the inequalities have to do with the fact that there are inequalities in the distribution of existing resources as well. Latin America, on average, spends $500 per person in healthcare per year, and less than half of that money comes from public resources. The rest are in the private sector, insurers, and out-of-pocket resources. And as the privatization that started over the past 2 decades also impacted on the healthcare system, the state, the federal government has lost the power to reach those sectors that cannot pay, those sectors that are either isolated or are in the rural areas or simply are at high risk and are not of interest for the private service of healthcare. So this is a problem that has weakened also the political standing of Minister of Health and of the health establishment in general. And in this vacuum, the private sector, including multinational companies and others, have entered again emphasizing the focus on preventing death as opposed to preventing disease, which is the goal of primary health care. So we have this general problem, and within that problem, then we have the problem of bad management or inefficient management of resources and so on, which obviously aggravate this.
Mr. Nuto Sanchez, there's a push to start and privatize, because Mr. Caballero mentioned it. Is this the best way to go?
Privatization? I don't know that that would be the best way to go. Where we work, the push is to become autonomous, because I work in a region that's completely made up of indigenous people.
When you mean autonomous, that means without government help?
Without government help. Well, without the official government help.
So then where would the money come from?
It comes from international funding. It's all external funding from Mexico, but also mostly from Europe and the United States.
But how stable can that be? Because that funding could stop at any moment.
That's the problem that we're working on. Exactly.
And also, isn't it a contradiction to be autonomous but then ask for help from international sources?
Well, I think the concern is, or was, and still is, the quality of care or the complete lack of care that the indigenous communities were given by the government. And what they believe is, rather than have a lack of care, they would rather go through a stage of building something that would be sustainable and completely independent in the future.
Mr. Benko, do you think that this can be sustained or can be applied to other countries as well?
Well, we work, for example, we fund small community health projects in the countries that we work with. Very small. For example, fund health care promoter trainings in small villages in rural areas where funds don't come from the government, where there's no health care. But I do think it's a mixture between this and also government-funded health care.
Because then you're taking the responsibility away from the government.
Exactly. What we try to do is make them sustainable, showing the governments that these small communities do need health care, that they should fund these healthcare promoter trainings or whatever other activities that were taking place. In Bolivia, we have a program for children in jails. There are women in jail, and they have their 3-4-year-olds with them, and there's no health care in the jails whatsoever. So we funded a little program there in Bolivia where the children get pediatric care, et cetera. So showing the government so they can take the initiative to fund those projects.
Mr. Caballero, what are your thoughts on this?
Well, I think we need to differentiate from the political autonomy, the control that communities and towns must have over their healthcare needs, with the fact that they need to generate their own funding to support the healthcare. I do think that there is an absolute requirement for federal authorities to provide the funding, and in fact, in some constitutions in Latin America, health care is considered a basic human right, and therefore is the responsibility of the federal government. This doesn't mean that at the community level, the community should have the power to decide whether they need another MRI machine or they need to increase immunization coverage for children. This, I think, is very important, to give this power to the communities, but with the support of federal funds and the taxpayers' dollars that are distributed according to need.
So you advocate a combination of both?
Absolutely.
What responsibility does the United States have, Ms. Danuto Sanchez, in trying to help these countries? Because as healthcare deteriorates, it creates bad living conditions, that increases immigration. What responsibility does the United States have?
Well, I would say their responsibility would be to create programs that actually got to the people rather than going to the government officials. There is absolutely no health care in the region where we work, which is a remote region in a jungle area, which is all indigenous people. And my understanding, at least what I've been told, is that this is true in many of the remote indigenous regions of Mexico. There are no clinics, there are no doctors, malnutrition is 71%. People have no electricity, they have no running water, no sewage, and they cook over open wood fires. All of these are horrible health conditions.
Mr. Benko, is there a misconception you believe in the United States that people think that because it is a state-run healthcare system that everybody has healthcare, and that's why they're advocating doing something similar in the United States?
Yeah, there is a misconception. In Cuba, for example, everybody does get free healthcare, but in Mexico, there is a lack of access to clinics. In Chiapas, for example, or in Oaxaca, where we have programs. There's also a lack of resources, as I've said before. Most people in Bolivia, for example, you do get free health care. Children up to 5 get free health care, but then the medicines, if you have a serious illness, you do have to purchase your own medicines, same as in most places in Mexico. So it is free to a certain degree. It's not as it is in Cuba. So the lack of resources in the clinics themselves and the people creates a problem, obviously.
And then a big part of it is then the corruption and the mismanagement that you had mentioned as far as the supply of the materials to the people.
I think so, yes. I mean, if you go to big cities such as La Paz or, Mexico City, you do have wonderful healthcare facilities for most people. The further out you go into the rural areas, I think it's both mismanagement and lack of funds also.
Mr. Caballero, is there a good balance that can be created between the private and government sectors when it comes to providing health care in Latin America?
I would hope so, because it's essential that both contribute to this problem. I don't think anytime soon we will see an economic situation where the state alone can provide universal coverage. And the economic system in the countries is quite different from the Cuban system. So the private sector will have to play a role just as it does in the rest of the everyday life of citizens in these countries. The key is who has the political power to define where are the needs and how to distribute the priorities. I think if the government and the health authorities have this power to define the priorities and have a rational public health program focus on prevention, not on treatment and management of complex conditions as it is now, the private sector can certainly support this with their strong resources.
Mr. Benko, what are some additional things that the United States can do to help in that respect?
I believe creating self-sustainable projects. As you know, what happens is these diseases, communicable diseases, know no borders, obviously. So you were asking before, why should the U.S. care about health care in Latin America? Because as we know from the recent scare, the TB scare from that passenger that flew from Europe, that there are no borders when it comes to communicable diseases. So we do need to make sure that Latin America has a healthy population.
It seems like a faraway problem, but it hits close to home.
It hits very close to home.
Toshimavax EGF aumentará el tiempo medio de supervivencia de 4 a 5 meses e incluso mucho más en algunos enfermos. Además, esta vacuna, a diferencia del tratamiento tradicional para el cáncer del pulmón, como la quimioterapia, tiene pocos efectos secundarios.
La caída del cabello es uno de los efectos de la quimioterapia. Este tipo de vacuna, el tratamiento no provoca ese tipo de efectos adversos. Y bueno, como le decíamos, se ha demostrado que es la base de registro que provoca un incremento de sobrevida en los pacientes avanzados sin tener un efecto adverso severo que afecte la calidad de la vida del paciente.
Según los científicos del Centro de Inmunología Molecular de Cuba, es una proteína modificada que ataca solo a las células cancerosas. Este medicamento continúa bajo estudios clínicos y posiblemente sea aprobado en varios países de América Latina, Europa y Asia.
Thank you. I trust you enjoyed today's program. I want to thank our guests here in San Francisco, Marianne Tenuto Sanchez with the Chiapas Support Committee, and Nick Benko, Program Manager at the Child Family Health International. And in Washington, D.C., Dr. Benjamin Caballero, Board Member of the Pan American Health and Education Foundation. I would also like to thank you at home or on the web for being with us today. We also want to thank the American University in Washington, D.C. and the students at the School of Communication for helping with the research for this program. Join us next time when we take a closer look at Latin America through the eyes of Latin American media. For more information about Curso Latino and Latin America, log on to linktv.org. I'm Ana Cuevas. Thanks for watching. We'll see you next time here on Latin Pulse.
Latin Pulse was made possible by support from the John D. and Catherine T. MacArthur Foundation and the William and Flora Hewlett Foundation. Pulso Latino es posible gracias al apoyo de John D. and Catherine T. MacArthur Foundation y el William and Flora Hewlett Foundation.
This program is brought to you by Link TV for educational and non-commercial use only. Link TV is the only U.S. network dedicated to global and national news, uncompromising documentaries, and diverse cultural programs. Programs that connect you to the world.